Okay, today is October the 4th. My name is Paul Bosworth. This is the AMAZE Brain Support Group. We discuss how healthy options and how to get healthier. We began in 2011 at various places, one of which was Our Lady of Lourdes. They couldn't really find a place for us to settle, so we moved on to another place, and COVID came along, and now we're in process to secure another place. And our director, Amy, is working on that. That's pretty exciting. We'll see what happens in the future. But main point of this whole thing is to offer information pointing to options that are out there. When I had my brain injury in 2007, I was told that there's nothing else that you can do for your brain. And I called bullshit on that. And it took me a while. It took me years because it just does. With brain injury, there was a study once upon a time that it takes 4 times longer for us to do a task than a person that's normal or fully functioning. You'll hear me say the word functioning because that's where that's where the sweet spot is for us. It's not necessarily the emotions. It's not necessarily the failures that we have in our bodies. It's the bigger picture. It's the bigger realization that you damage something that was functioning. See if we can bring function back, which is very new. It's very interesting, and I don't know of any other place in Louisiana. We're based in Lafayette, Louisiana, that does that. We did get a new functional neurologist who happens to be a chiropractor, and his name is Quentin Harrington. So if you're looking up that, then great. Angelique Miller is another one. So we have 2, and there's a gentleman in Lake Charles as well that also focuses on functional medicine, and I don't remember his name off the top of my head. So with that said, and oh, by the way, it turns this group turns heads. This group's focus, this group's direction turns heads to say, I didn't see it that way before. That's an interesting perspective, because we've been treating, no pun intended, from top down, and we need to come from inside out, is what we're realizing. I do attend Brain Injury Awareness Day every March, except for COVID, and it still hasn't opened back up yet. Maybe, hopefully, in 2023. And those where the movers and shakers come to meet. Unfortunately for us, it's a big giant noise box, because it's what marble floors, marble walls, and maybe a wood ceiling or a composite ceiling, but it's loud. And the first time I went for like maybe 3 minutes, but it took me an hour and a half to get there. So we'll do a GoFundMe beginning of next year, and once we find out whether it's going to happen, that is the who's who. And if you ask me, I can discuss, who I've met and all that kind of stuff, but it's not about me. Let me just say that right off the top. It's about the next person, the next person, the next person, and the next person on an infinity who calls me and says, I can't get relief. I have problems. Last week, a gentleman that owned a business, still does, he has anxiety issues, and it goes off the rails within an hour or so. And I said, what about cannabis? He said, I've never done that. And then the conversation goes on from there. And so without further ado, amaze your way to a better brain. What is AMAZE Brain Health Group? Went into it pretty much already, but I'll read what's here, read over what's here. 80% of our wellness is pretty much on us. Is that a big deal? Yeah, it's a big deal. So that's what I and we are trying to approach, is the 80%. and try and pick the head up of the person that's been told there's nothing that can help. There's nothing out there. Nourishing food is helpful. We usually bring that to meetings when we meet in person, including red beans and rice. I make a pretty good one. Food for the brain. That's basically encapsulates the evening. Together we heal is our mantra. There's no sense in going through this traumatic brain injury by yourself. And the goal is to figure out the new normal. I asked a professional one day if I changed my DNA when I had my substantial concussion, and they said, yeah, you did. And so, and the speakers come from their professional offices and share what they do. And also they'll share information with our group. And it's kind of exclusive, to be honest. Just really excited about doing this. And we're going on year 12. Den of denial. This is the first place to end up. It is an injury, but I look fine. I'm not understanding what's going on with my body, brain, mind, soul, spirit, feet, legs, eyes. But I'm fine. Don't worry about it. I'm fine. Once that person gets home or she gets home, it's like, I don't want to be here anymore. I really want to just go at life, just reckless abandon sometimes. Scares me when that happens, but there's no filter. So all of a sudden you look fine, but there's no filter. Well, in some circles in South Louisiana, that fits. They'll laugh at that. It's really funny. He seems to know where he wants to go to get better. Brain, I'm not sure. Do I stay with the pharma, or do I try something else? And by the way, when I meet someone and they start talking about their brain health, I'll ask the simple question: have you ever conked your head? And the first answer 9 times out of 10 is nope, never have. Well, what the reality is that we're missing them. We're skipping over them. And 5 times out of 10, so 5 out of those 9 will come pass back around and say, you know what? When I was 19, I rolled a big old SUV and I jumped around in there like a jumping bean. I hit my head, I think. But the clavicle was broken and the arm was broken and the leg was broken. We got good fixes for that. That's great stuff. But not for the brain. And mental health pharma can help some people, but for the majority, it adds more worry and anxiety and pain. So some of the speakers that we had, I'm trying to move this so you can see it and see the whole thing. Sorry. In January, we had Darcy Keith. She's a colleague of mine that works on the Brain Injury Advisory Council connected to Brain Injury Association of America. And she teaches to overcome the big things in life so the little things don't matter. I call them little crumbs. You're focusing on the crumbs where you could really benefit from a bigger idea or a bigger concept, and then the other stuff will just fall into place. She was in a car accident in the 90s where there was really little, if any, Google. I think Google came along in the mid 2000s. Her mantra is to never give up. She pulled herself up out of rehab. Her family supported her the best way they could, because again, there was a lot of ignorance around what had happened. She lost 2 of her friends in the car accident. And today she works in Indiana. I forget the name of the city, but she does a keynote speaker. Her website is darcykeith.com. Extraordinary woman. Can we all be like her? Sure. Do we all have to be like her? No. But she inspired us, and started the year off on a great foot. dry needling, acupuncture, rolfing. We had Matt Kavanaugh come speak to us, and he is a chiropractor here uh, off of Congress. And hey, Jessica, nice to see you. There's a picture of Jessica. She does rolfing. I'll put the definition of rolfing because it's not going into my noodle the way it's supposed to, but a technique of deep tissue manipulation aimed at the release and the realignment of the body. If you're in an accident of any sort, pretty much something's going to be, I call it like a Jenga stack, and it's going to be off, or it's going to be a little off, or it's going to be here, there, and beyond. You're welcome to make a comment, Jessica, because I'm kind of sinking here.
You're doing great, Paul.
Thanks.
And that's a pretty good definition. The other thing that I would say is it works with how all of the functional units work as a whole. So while your primary area of injury might be the neck, cervical spine, AO joint, jaw, aligning the shoulder girdle, thoracic spine, pelvis might all help improve outcomes musculoskeletally. So yeah, great job.
Thank you for being here.
Yeah, thanks for having me.
Cheers. You're on the list, so you're going to get invited to the next one.
Spoiler
alert.
I love it.
Good. Awesome. So we had Mountain Pure CBD come visit us. Heather, if you remember her, she has a son, and at the time he was either developmentally delayed or there was some hiccup that medical science came in and said, we're gonna do this, and it might work. It's going to cost between $12,000 and $16,000. And if you remember Heather, she's very outspoken, and she had a lot to say about what her son was going to do and not do. But in the process, sometimes necessity causes invention. She started with two other people a CBD company that is primarily for substance abuse folks, and which kind of sideswipes this group for sure, because we can go on, these tears where we'll eat the whole pack of brownies, or we'll drink the whole jug of milk or whatever with no filter, with reckless abandon. It's almost the same trigger, if you will. But Heather is a person that will stop what she's doing. She's based in Baton Rouge. She's also based in Los Angeles, California. But what's great with her is that you walk her through what you need, and she'll suggest different things to help. The U.S. has taken note of marijuana, weed, cannabis, call it whatever you want. And it's interesting to note, there's always somebody that's going to say no. And apparently, Dr. Daniel Amen out of Los Angeles, Newport Beach, Atlanta, DC, and I think New York somewhere, has just totally said no to marijuana, period. And I don't know where that's coming from. That's not what folks. Yes, Chantel.
I follow Dr. Amen. I have his book on marijuana, which was written by a doctor. He wrote the foreword for the book, but it was written by another doctor, and it has like everything cannabis related as far as the medical side of it. I learned a lot, but unfortunately can't remember a lot of it, so I have to listen to it again. But yes, he says no to lots of different things, but he also says that for us, for people that are in our position that need it for pain, that this and that, like if it's going to be us choosing this or alcohol, then we should go this way, then that. Like he understands, yeah, but because of the brain scans, whenever he does SPECT scans, which shows blood flow, and so when you smoke marijuana or drink alcohol, it makes the frontal lobe disappear. That's
Mm.
why you don't make good decisions on alcohol.
Ah,
I understand alcohol. I did not make really bad decisions ever on THC. Alcohol has been that bad culprit, you know.
uh-huh.
But yeah, I adore Dr. Amen. I have his cookbook. I have, you know, I follow him. But that is where we differ on opinion, you know, because I don't have another all natural way of dealing with my pain other than ice and turmeric.
You took the words right out of my mouth. I'm sure my interpretation was, because folks will go to alcohol first. I've seen it time and time and time again. But if push comes to shove, you're saying that the lean is toward marijuana versus alcohol or harder drugs. Yes.
I personally have tested the effects. I have a severe traumatic brain injury. I tested as far as alcohol is concerned. I had one glass of plum wine. That is way too much.
Yeah.
I paid for that for a week and a half after because I moved in ways that I can't normally move, and it caused a lot of pain for my head, neck, and back for after. Sake, because of the body high, I tried with sake. The problem, as you've stated before in our last meeting, is with alcohol, it enhances everything that my brain injury already does to me. So it throws off my balance even more. I already sound like a drunk Russian toddler, you know, like, oh, you're really not going to be able to understand me if I'm drinking. I do know that it takes away the pain, so it's very effective for that. But I know my limit. I know I have little sake cups. I have 2 or 3, nothing more than that, and that is it. But I also know how it's going to affect my brain injury. Marijuana, I've used marijuana products in California the entire time for 3.5 years before I get here. And now I use hemp products, and CBD has always been mixed in with the THC products.
Thank you. Thank you. I'm going to get to that in a little while. So thank you for jumping in. I greatly appreciate it.
As far as my balance, after I smoke marijuana, it'll affect my balance only for the first 15 minutes, not for the entire time. Unlike alcohol, it affects my balance the entire time.
We'll get to that. We'll get to that. Hang loose. Thank you. I'm finished with this one. This is just a visual that I caught from Irish hemp, and I'm thinking that's in Ireland, but this wheel is gigantic. And what doesn't it not help? Within reasonable boundaries, right? It's not like you're gonna go eat the whole thing. It's medical marijuana. That's what the state of Louisiana is offering. That's what I have. It's hemp. And boy, do I sleep better. My fatigue is less because I sleep better. But I haven't figured out the diabetes part. But yeah, you see the word anorexia. I gained 30 pounds. Some of these, I find women, but some of these folks will lose weight. And we'll get to that as well. But just a visual to kind of give you an inference into what can be aided and abetted. We also had Callie Picard come. She's a speech language pathologist, certified as well. She started off, I met her talking about stutter, stammer, aphasia, word trip ups. And now she's she's working in a van, driving around town to test people to swallow. Swallowing is a brain function in part. For me, it's the reason why I have my brain injury was due to swallowing, because I choked. And it does still visit even today. One of our members was shocked. She's like, I just thought it was me. But grateful to have her come and share. She loves this group and gets why this group exists. When Harry met Daphne came to visit us, Harry is a nocturnal, I'm losing the word. nocturnal psychotherapist. So he works mainly in the evening hours. Daphne is the unconventional dietitian. Why is she unconventional? Because she wants to teach you how to eat yourself healthier and move on with life, changing those habits, changing what was to what will be. Some of the stuff that we learned was cold water fish is really great for the brain, salmon, tuna. The brain is connected to the stomach. The stomach is called the second brain. The heart is sometimes also called the second brain, but in this case, in this inference, it's the stomach connects to the brain. You feed one, you feed the other. Gut can work with probiotics as well as fiber to balance. Sugar hurts the brain. Refined sugar is terrible for the brain, especially, again, the white stuff, the refined stuff, the Easter, I cringe. The Christmas, I cringe. I know it's a part of our culture. I know this isn't exactly the happiest slide ever, but working through and balancing your gut health with some probiotics maybe would cause that brain gut connection to balance. Harry, being the nocturnal psychotherapist, talks about meditation to calm and sort out what happened that day. And being apologetic. Thanks, Chantel. Yeah, you're right. It really isn't food. Find yourself being unapologetically authentic. That's key for folks that have had brain injury, because I can speak personally, and I can speak for several people that I've talked to over the past 15 years, 11 focused, and they already have said they're judging me. I know they're judging me. My head doesn't turn right. My mouth sags. I can't see straight. I have to tilt my head down. Yeah, be like me and just tell them, get it over with. But yeah, be unapologetically authentic. And they have a website. Actually, Harry Turner is on Facebook. You can reach him there. Harry's based in Baton Rouge, but he'll do a phone call if you need him to. He was supposed to speak tonight, but our schedules were crisscrossed. So you get me. The unconventional dietitian, Daphne Olivier, is in the Tops building on Johnston Street here in Lafayette. And she's also in Baton Rouge, but I don't know where she is exactly. Unconventionaldietitian.com would be her. There she is. Craving sweets, blown, all the stuff, especially if you're taking medicines that cause more symptoms. So good, she visited twice. Dr. Mary Louddale, we have 2 hour-and-a-half conversations with her. She's had, her education is a speech language pathologist, certified as well. She stayed in it for decades. I think it was 30 years, and treated hundreds of TBIs over her career. So she's kind of the TBI whisperer of our little group. And there's 2 wonderful posts on the AMAZE TBI YouTube channel. And her message was, in short, we can take ownership of our brain health with help. But it does take someone to walk with you, usually someone you trust, usually someone that gets you. And as I mentioned before, our brains change after brain injury. Sometimes it's awesome, cool, wonderful, and sometimes it's challenging to get to the awful, cool, wonderful part. Life dynamics change as well. You have to have ramps now. You have to have, I wear earplugs. I don't go out as often as I used to, because as someone was mentioning earlier, people can be too much. The AMAZE TBI channel, 2 videos worth watching over and over again, because they're chock full of information that could change your attitude, could change your perspective. And then we talk about hyperbaric oxygen therapy, and the doctors Miller, Hargrave, Cormier, and Moreau, she's an RN, registered nurse. She's on the call today with Acadiana hyperbarics. But oxygen to a wound under pressure enables a body to heal, especially the brain. And let me just say right off the top, you don't have to go deep. You don't have to go, super duper hard to get to the brain health. It's shallow dives. Did you want to say something, Jessica? You don't have to if you don't want to, but I was.
Yeah, sure. So speaking to low pressure, because this is oftentimes a question people have, like, oh, I want the thing that's in the hospital. That's got to be better. If a little bit's good, more must be better. And that's just not the case, especially with TBIs. Yes, for something like a gangrene infection of a limb, that could be good because time is not on your side. But actually with brain health, you can, with TBIs, Alzheimer's, low and slow is actually better because hyperbarics has a slight vasoconstrictive, meaning your blood vessels will constrict with the more pressure. And so finding that sweet spot of increasing the pressure so you can stimulate all the things like brain-derived neurotropic factors, stem cells, angiogenesis. You want to stimulate those, but you also want to keep those blood vessels to the brain that you're trying to supply these brain-derived neurotropic factors and stem cells to wide open. So they're actually starting to do some research about how the milder pressures are better. Plus, people have less sensitivities and less risk of things like seizures and whatnot with the lower pressures.
Thank you. The way I was forced to look at it is when the guy told me you had to do 40 to start off, I was like, wait a second, 40, that's a lot. And I walked away thinking, well, it took me 2 years to learn how to walk. It took me 4 years to learn how to talk and speak clearly. It took another 10 years to graduate high school. We aren't going on a rocket ship here. We can do this incrementally. And the soft chambers, as Nurse Morrow and I are discussing, are easier on the body. They're easier on you and delivering what's needed. I do have a YouTube link here. I'll send out. I don't honestly. Oh, it's the reason why. It's the reason why I did jump into it. You want to see it? Give me a thumbs up if you want to see it. We're good.
Yes.
Thank you.
Yes. Sorry, I just had a toddler who was getting out of the bath that I was trying to keep from. Sorry about that.
That's okay. Can you see this? Is that it?
Not yet.
Do you see this? Tell me yes or no.
Not yet.
Huh. Okay. Then if it doesn't work for one, it doesn't work for all. Can you see that?
I hear something.
Okay. Then this is not working. I'll send this out later. But basically, it was a young guy, 16. This was 10 years ago, so he's probably in his mid-20s by now. Ran his Chevy truck into an embankment and was treated and released in a really fancy chair that tilted for him. He couldn't sit up, he couldn't focus, he couldn't do anything. And at the end of the year that he did hyperbarics, he was walking and talking. So I'll leave it at that, but I'll send it out to the folks here because I'm sorry it didn't work. But what I did do was include my pictures, if you don't mind. And so I'm looking at you. This is July of 2012. And I'm looking at you on the top. On the left is before 40 treatments, and to the right is after 40 treatments. Before, and I'm speaking slow on purpose, before you can see brain missing. So those brain cells are dormant. They're asleep, basically, from what I've learned. And did 40 dives, each treatment's a dive. And afterwards, look at all the brain cells that came back to life. And one can argue, because I am, that brought function back. So my stutter went away, my stammer went away. However, when I get excited or nervous or pressed for time, or they come out, I get it. But in real time, I can talk to you and you're asking me you're asking me to keep talking, versus people would ask me to stop, please stop talking. Again, on the bottom, I'm looking to your right. And the big deal for me was this part right here, the frontal lobe, because I would go to the grocery store and buy cookies, milk, and those big 120 load washing machine liquid laundry detergent, and I would do it every time. And when I moved out of my apartment in Washington, D.C., there were 6 gallons of milk and half of them hadn't been touched. But I was going to get that. And oh, by the way, the cookies didn't make it home. Sugar, it slipped me right in. It was my denial's best friend. But as you can see on the right, we gained some of those back. And I didn't put the most recent one up, which is a little bit more brighter. I don't know what the colors mean here, but these pictures were taken in New Orleans at used to be called West Bank Hospital in Marrero, but now it's called LCMC. And you do it in the nuclear med lab, and you use the harsh protocol. And probably the coolest thing I've ever done, and it's worth at least mentioning here. Then oh, sorry, Chantel, do you want to say something?
Is a nuclear what? Was this?
Have a conversation with me later. It's involved and detailed. It's a nuclear med. You put yourself into this tight, you think MRI's tight. This one's right at your head, and it goes all the way around, and it takes a beautiful picture of what's been damaged. But yeah, we can.
It looks a lot like SPECT scan.
It is. It's a brain SPECT scan.
Excellent. Okay.
And you use
What I
Serotype.
want to get. This is on my to-do list. This is cool.
This is why we're here, Chantel. Thank you. Yeah, absolutely. You use a Serotype radioisotope. I researched this for months because my parents left me money, and I'm not going to have them come down from heaven and fuss at me. So, it took me 3 times to try and get the doctor's attention, because the first 2, I just hung up on him because I said, Paul Bosworth, brain injury, oxygen therapy. And he went, yes, click. My brain couldn't handle it. So when he did meet me, he was very intrigued. He's like, you can talk. Yeah, I can. Just don't stress me out. And because the funny thing is, I couldn't see you. I couldn't talk to you. So that was a little bit of a challenge. And hyperbarics helped me through that, or helped get that function back. This is a big topic. Sorry, did you want to say something?
I'm hoping hyperbarics will make it so I can have no more problems with elevation. I have difficulties going from standing to sitting, to sitting on floor.
Yeah.
And early on, I was thinking about it. I'm like, well, trying to figure out, I don't know what part of the brain, all parts of my brain are affected, but I started thinking, I used to know deep sea divers that did like underwater welding, and whenever they came back to sea level, they had to go in oxygen chamber. And I'm
Right.
like, hey, that has to do with elevation. Maybe that'll help me. So I'm hoping that that'll help me with that part of my issue, among other things, of course.
That great. I hope it does.
I'll let you know.
Yeah, let us know. I was fortunate enough to know a bunch of divers, and and you ever notice that the older they get, the better looking they get because of the oxygen that they've taken for 20 years, 30 years, it resides, it stays there. I met this guy who was 75 years old. I wouldn't have put him a day over 50. And yeah, he was a cool cat that drove a Cutlass, 76 Cutlass. I'm like, who is this guy? But I wanted to approach this subject because this comes up weekly in conversations, because it's not that the fact that they can't drive because they're on so many medicines, it's they can't drink alcohol anymore. And I went to MSKTC. It's an acronym. It's on Capitol Hill. It's basically a knowledge transfer center for burn, traumatic brain injury, and spinal cord injury. MSKTC.org. I sit on the board. Apparently, I don't get many emails from them, but they are a working group that the president signs off on, and it's every 5 years they get another president to sign off on it. The key here is no amount of alcohol is totally safe after TBI. For me, it brings out all my symptoms in spades. I mean, real quick. I'm moving stuff around so you can see it. Alcohol and TBI recovery. It can slow to stop your recovery. Not drinking, and it's interesting how these statements that I pulled directly from their website are very carefully pronounced. People's lives often continue to get better many years after TBI. This is new. This is within the past several years, 5-6 years. Not drinking can increase the chance of improvement. Drinking may also increase having another one. It can increase the chances of a seizure. It can increase, not drinking can reduce the risk of having another TBI. Alcohol and TBI affect cognitive skills functioning, like memory, flexible thinking. This is thinking about different things, thinking about things in a different way. Alcohol may affect people with TBI more than it did before their TBI. So things change. Not drinking can keep your cognitive abilities at their best to help you stay sharp and focused. Who wants that? That would be me. Alcohol and mood. Depression is about 8 times more common the first year. Alcohol can cause depression and make it worse. So you're drinking depression, you're drinking anxiety. You might have fun with the gang, but where does that leave you ending up? Alcohol can make an antidepressant useless. People who take these medicines should not drink. One way of improve feelings of sadness and depression after TBI is to stop or cut down on drinking. Alcohol and sexuality. Low sex drive is real common with TBI. Or conversely, it can ramp it through the roof. I've personally had this play out right in front of me. So, and most of the people who call me are women. So I'd meet them at the Jason's Deli, a very public place with lots of people and lots of things going on. And yeah, so, but it was fascinating for me to find out that it pitches people in either direction. It's either one way or the other, and it's extreme. It can mess up bodily functions, sexual functions. If you drink alcohol, you're not going to like it as much. Avoiding alcohol improves sexual ability and activity in men and women, period. Tips and strategies. Oh, my face is covered up. That's me. This is a Hall of Famer. This is the event that I go to every year on Capitol Hill. That's the Marble Room. That's Stephanie from Georgia. That's Amy from Minnesota. And this is, I can't remember his name, but he was super duper tall. And he's worried about CTE, which is chronic trauma encephalomia. I can't say that word. Basically, it's an extension of some part of your trauma that doesn't go away. And it can turn in on itself. But what we talk about here is to be patient with yourself, most importantly. Love your caregiver or caregivers. Remember to breathe, because we do forget, and that will enable better decisions. Eat before you grocery shop. Eat before you go out. Eat before you do anything, so you'll fuel yourself up. I'm not saying a full meal, but eat something, a snack, a low sugar snack. Earplugs help to drown out loud venues. There's at least 2 ear, nose, and throat doctors here that will fit you for earplugs. Water, the clear liquid, to refresh the entire body, not with colors in it, not with sugars in it, not sodas are tricksters. Try not to fall for it. I recently gave up Diet Coke that I've been drinking since a long time, like 30 years. It just wasn't worth it.
So I got a hack for the Diet Coke thing, because as a nurse, I had a terrible of all my health habits. It's like it was pretty easy for me to check. Oh, this is my daughter, Finley. Say hi.
Hi.
She dives with me in the hyperbaric chamber, right?
Cool. Hi, Finley.
Love your name. It's
Thank
beautiful.
Thank you.
Thank you.
But there is this. Thank you so much. That's pretty.
Thank you.
So I had a terrible Diet Coke habit. It was the hardest thing for me to, it was my last little thing to work out to achieve some of my health goals. And I recently found this prebiotic soda, which
Really?
kind of scratches that itch of wanting something sweet, but it actually, you were talking about the gut brain
Connection.
connection, and sorry, got a little one here. And it actually feeds the good bacteria that helps with a lot of the
Do you have a
very distracted by a little one. A lot of the dopamine, serotonin, neurotransmitters, and it's called Olipop, and it's delicious, low sugar.
spell it?
Olipop.
Olipop. Okay.
And it's also a great mocktail if you're kind of missing that sweet, sparkly thing in the evening. All natural.
So we can drink it with our pinkies up. Yes.
That's right. And be fancy.
How many sugars?
Thank you.
I think it's like 8 sugars.
By all.
Yeah.
I tend to try and stay 18 below
Mhm.
whenever I do things like that.
Yeah.
All right. We good?
Yes.
Thank you. But the last bullet on this page is, to me, critical. It's the cornerstone of my recovery, is be thankful for everything, even the bad stuff. I did a function with a Jeep group here in town, and they did a fundraiser. We raised money for the brain injury office here in Louisiana, And it was a nice big old check. And they came to me and they said, and they were kind of jerks, and it was not very good back and forth. It was exhausting. I felt like I was doing everything, and others around me said, yeah, you were. But I was thankful that this group moved on to a different cause, because that freed me up to do something else, whatever that is. Be thankful for, like today, I dropped a $65 fan. Didn't need that. Why did I drop it? Because I drop things. That's just what I do sometimes. But being thankful for everything also gives the person you're talking to or interacting with you, it gives them the inference that you're in this to win it. You're not just throwing your hands up and giving it up. I'm not saying anybody is, I'm not saying anybody isn't, but to realize that there's a higher power in all this, and maybe that wasn't for you. You know, I meant to go get donuts and I did all my errands and I didn't get donuts. Hey, that's a good idea. Great. You don't have donuts. Eat a slice of bread with some butter on it. It's better for you anyway. And I can go on all night about being thankful and showing thanks to others, especially when they lend you a guiding hand or a kind word or a note, or heck, even a hug. We're rounding the end of this, but this guy is from south of Lafayette, from a very small town, but he carries a big stick. And what I mean by that is he's got letters behind his name, and he'll tell you, if you ask him, he'll tell you straight away he's had 3 concussions that he knows about. And what he does is he gets people moving, and he's all about wellness. And if you get him started on answering a question, pull out your phone and tape what he's about to say, because it's chock full of information. He did a lot of his training up east in Rhode Island, and he also is certified on the European rules on a certain aspect of one of his certifications. And he's right here in the oil center. So I'll leave this up for a minute. But and this is just a theory of mine, since I've been doing my best to answer the phone and see what's what. If a survivor can become belligerent and angry post-trauma, then someone else can become very passionately suggestive sexually post-injury. That's my theory. I think we're about done. Thank you. Is there more? No. Okay, so watch your eyes, because I'm going to stop sharing. Thank you. We're done. And I'm going to appreciate everybody for coming, but stay on. Don't go anywhere. Our next meeting is on the 1st of November at the same place until noted otherwise, but stay online here. I'm going to stop the recording. So I invite anybody to put a comment or like the page, because this is going to be on YouTube. And thank you all for coming.